Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay, and I'm your host. Today, we're sharing what you need to know about brain injury. To help us learn more is the director of the Brain Injury Research Center at Mount Sinai, a clinical neuropsychologist and professor in the departments of Rehabilitation Medicine and Neurology at the Icahn School of Medicine at Mount Sinai. Let's welcome Dr. Kristen Doms O'Connor. Dr. Doms O'Connor, welcome to Mount Sinai Live.
Thank you. Thank you for having me.
Let's start with brain injury, since that's the area you specialize in. What goes on in the brain during a traumatic brain injury?
So a traumatic brain injury happens when a blow to the head or to the neck results in a loss of consciousness or an alteration of consciousness. So an impact to the head can cause the brain to rock back and forth and bump up against the inside of the skull, which can cause bruising. It can cause tissue damage and swelling. And what can happen is very small blood vessels can rupture and cause bleeding inside the brain. And those rotational forces can cause shearing and tearing of axons, which are those long connective nerve fibers in the brain. So a TBI can cause focal damage, but it can also cause what we call diffuse axonal injury, which is really a hallmark of traumatic brain injury.
Let's talk signs and symptoms. What are the signs and symptoms people should be looking out for, on alert for a traumatic brain injury?
So some are very obvious, very concerning. Loss of consciousness, a seizure, vomiting, pupils that are dilated or that are unequal in size, severe and worsening headache, weakness in arms or legs, slurred speech, or severe imbalance or dizziness. Other signs, though, are more subtle, but should still be closely monitored. So these are things like headache, fatigue, sensitivity to noise or to light, double vision, and feeling kind of dazed or confused, feeling out of it, or changes in mood or in cognitive performance. One thing that is really important to note, I think, is that a loss of consciousness is not necessary to diagnose a traumatic brain injury. And in fact, most traumatic brain injuries do not result in a loss of consciousness.
Yeah, that's something that was definitely a myth. Definitely something people thought of for a long time. If they didn't lose consciousness, it wasn't a traumatic brain injury. But we know now that's not the case. What should someone do? What's tactics if someone suspects that they themselves or a loved one has sustained a traumatic brain injury?
Any of those concerning symptoms that I just listed, you go to the emergency room, you call 911. Any symptoms that worsen, go to the emergency room, call 911. This is often a challenging decision point. Do I not need to go? You can consider the context, right? So you bump your head up against a cabinet, not likely to cause a traumatic brain injury, but a high velocity injury, a fall from height, you seek help. And young kids and older adults, it's important to keep in mind, can sustain a TBI even in lower velocity injuries, falling from standing, falling from sitting, and should seek care. So I think big picture, we err on the side of caution here. Even in a relatively low concerning context, see your primary care provider, go to urgent care. And I think regardless of whether you choose to seek care or not, you always let someone know that you've hit your head so that you're not alone in case symptoms do worsen.
Let's talk about how common traumatic brain injuries are. Give us some information about that, some background.
I think they're a lot more common than people realize. According to work that has been led by some of our colleagues, over 20% of people in the United States have sustained a traumatic brain injury with loss of consciousness. The numbers are higher when we count injuries that do not result in loss of consciousness. A lot of those injuries go undiagnosed and untreated. And that's especially true for injuries that are sustained in the context of abuse or intimate partner violence. And I bring this up because we have learned through our research that people with untreated traumatic brain injury have worse outcomes than, in some cases, even worse than those who sought care. So actively screening for traumatic brain injury, especially in settings where we know TBI is especially prevalent, like homeless shelters, intimate partner violence services, prisons, is really important to help people get the care and the services they need.
You mentioned untreated, undiagnosed. So let's talk about long-term health consequences. What are those? What are the long-term health consequences of a traumatic brain injury?
My colleagues and I often say, if you've seen one traumatic brain injury, you've seen one traumatic brain injury. This is one of the most heterogeneous clinical conditions that there is. It's really hard to predict outcomes. We do a terrible job of this, and it's a really high priority area of research, because people who sustain an injury, they want to know, what are my chances of complete recovery? And people who sustain an uncomplicated mild TBI, which is what you often hear people refer to as a concussion, we expect the vast majority to recover within days or weeks. More severe injuries, though, and a subset of those with mild TBIs can have ongoing symptoms. And these can include cognitive impairment, depression, anxiety, irritability, disinhibition, things like fatigue, motor changes. Any or all of these things can really influence the way a person interacts with people and their ability to live independently.
If you've seen one traumatic brain injury, you've seen one traumatic brain injury. It's a great information right there. As we talk right now, it is the last day of Brain Injury Awareness Month. Why is it important to bring awareness to TBI during Brain Injury Awareness Month?
There is a lot of misinformation, I think, and a lack of awareness in general about traumatic brain injury in the community. I think this has changed. I think we have done better and better. But a traumatic brain injury can result in what we call an invisible disability, which means that in many cases, there is no overt physical sign of injury, like you might have if there's a broken arm or a physical disability. So people around you might say, you look fine, but inside, a survivor may struggle to keep up with a conversation, to understand jokes, or forget things that they needed to do. And this can be isolating. It can be lonely. And we want to raise awareness about what a traumatic brain injury is, how it can change a person's life. And we want to use the research that we do in the Brain Injury Research Center to advocate and to inform health policy to make sure that people with a traumatic brain injury get the care that they need, the support that they need for as long as they need it. It's a key part of the mission of the Brain Injury Research Center, is to educate, to advocate, and to raise awareness. So it's something that we do all year. And we're grateful that there is this month where we can all amp up our efforts.
You mentioned information and advocacy. Is there a resource that you would direct people to if they wanted to find out more about traumatic brain injury?
Our research center has a website, tbicentral.org. You can go to our website and learn more about the studies that we do, what we have learned to date, and find links to a lot of resources both in New York City and New York and across the nation for people with brain injury.
Excellent. Dr. Doms O'Connor, thanks so much for the insight. You can find us at Mount Sinai NYC at all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay. Thanks for watching.